most of the things that we've been told about nutrition in the past have turned out to be wrong. And so we're all walking around with assumptions about what to eat that is wrong.
Jonathon Wolf wants you to stop guessing what to eat. He's the co-founder and CEO of ZOE, the science-backed nutrition company helping millions of people understand how their bodies actually respond to food. We talk about how he went from adtech to healthtech, what it's like to bridge academic research and consumer software, and why personalised nutrition could change how we live and eat today. I'm James Wise, and this is What's Next? Conversations with the CEOs and founders building the future. Jonathon, great to have you here.
James, it's such a pleasure.
So maybe before we start talking about the challenges of building a frontier and scientifically led business like ZOE, let's start with what is ZOE today and how did you get started?
So ZOE is a science and nutrition company, and our mission is to improve the health of millions. We've been doing this for about 8 years. We now run the world's largest nutrition science study, and we use that to create an app that helps you to understand exactly what you should eat in order to improve your health, and where you can take a test kit that allows you to understand how your body works, and particularly your gut microbiome. So these trillions of bacteria inside your gut, which are completely different between you and me, understand what is actually going on inside you, use that test combined with all this other data you give us to be able to give you personalized advice, and then help you on a journey over time to understand step by step how to make a whole series of small changes, which over time add up to really transformational change in your health.
And what started you on this journey? 8 years ago, what is it that you and your co-founder George started thinking about and were motivated by to kick ZOE off?
So the start of this was I had absolutely no idea what I was going to do next. So I had been at a previous company called Criteo, which was using machine learning, as we called it then, and we would call it AI today, to create individually personalized ads. And I had joined this company when it was very small. I was chief product officer, and over the next 7 years, it had gone from like 30 employees to 2,000 employees, no revenue to close to $2 billion of revenue. We'd gone public on NASDAQ a couple of years earlier, and I had left about 12 months earlier because 12 months before I started ZOE with George and Tim, because I basically felt it had been an amazing ride, very exciting, but there was also something really wrong here. It was founded in Paris. There were about 500 engineers in Paris. These were probably like the smartest computer scientists in France, because at that time, Google hadn't even opened an office, Meta hadn't. And what they were doing was taking all of that incredible intelligence and training, building these incredibly sophisticated algorithms, in order to get people to click slightly more often on ads. And so there just seemed like this massive mismatch between the technical challenge versus like the value. And it wasn't bad. We were not doing anything wrong. We were helping people to sell some more things. That's not bad. We were helping to fund open published sites on the internet, but we were definitely not making the world much better. And I just felt, I don't think I want to spend the rest of my life doing this. And so I left Criteo. I took a sabbatical. I said, I just need to take some time off and figure out what to do. And then I was like, after about 6 months of this, all right, I need to find something to do. I know I want to use this AI. I know I want it to be for something that feels it has more purpose. And honestly, James, at that point, I was like totally stuck. I have no idea what to do. And by the time I stumbled across Tim, I think I was a bit worried that I might never find like this thing that was going to be exciting enough to do.
And you want to talk about sort of Tim Spector, Professor Spector, and your sort of what motivated you to build a relationship with him? Because in the technology industry, as you said, you've come from adtech. George, your co-founder, came from more consumer software, and we worked with him previously. That neither of you, as I understand it, have scientific training or backgrounds, and you ended up co-founding with a great academic and scientist.
I think like many things in life, there was a big element of luck in it, James, is the answer. So I had a personal interest in nutrition because in my early 20s, I suddenly got hit with this whole series of food intolerances. I'd been very sick with what we call glandular fever here in the UK, or mononucleosis, they call it in the US. And before that, I was never thought about what I ate. Just lived on pizza and fat Coke and burgers like any regular 22-year-old young man.
And the president of America. Yeah.
Indeed. And then afterwards, I was having all these food intolerances, and I went to see all these doctors. At first, they're like, oh, you might have bowel cancer or something really serious. I didn't, which is great. And they're like, oh, there's nothing wrong with you. You've just got like these food intolerances. Like, give up all this fiber. It's causing you problems, and you'll be all right. And I improved the quality of my diet and thought about it, and those intolerances got better. And then when I just turned 40. I just left Criteo. I was interested in like, well, do we understand more about this? Like, I've been thinking that I'm eating a healthy diet, but am I? And so I ended up going to a public lecture that Tim gave because he had just published a popular science book called The Diet Myth, which was his first popular science book talking about the gut microbiome and how important it was for our health. And I went to that lecture. I had no belief that this was going to have anything whatsoever to do with what I was going to do with my work. I heard Tim talk, and like a light bulb went off in my head, because he had been doing this thing called the UK Twins Study, which is now 30 years old. There's more than 12,000 identical and non-identical twins in it. It's the most intensively studied population in the planet, like millions and millions of vials of blood and poo and you name it, tissue in minus 80 degrees freezers in St. Thomas's Hospital collected over 30 years on these people. And it was a sort of light bulb, as he said, like, we have just discovered almost like this new organ inside human beings. It's called the microbiome. And it turns out that these trillions of bacteria inside us, they aren't just sort of irrelevant passengers. They are doing really essential things for us. And it turns out they're all different. And genetically, we are actually incredibly similar. We're like 99.9% the same, but you and I are like 75% different in terms of our microbiome. Why does that matter? Well, because he'd been doing these twin studies, and originally he thought, well, identical twins will be exactly identical because they have exactly the same genes, and they're brought up in exactly the same environment for the first 18 years of their life. And so science, when he started this study, said they will be exactly the same, and they're like the perfect people to study and understand how our genes shape our destiny. But there was one problem. They aren't identical. And in fact, it's really interesting. If one identical twin gets breast cancer, there's only a 50% chance the other one does, right? Which is, think about something that feels like, surely that should be the same. But he also got really interested in how you could have a lot of identical twins where one might end up living with obesity and the other doesn't. How's that possible? And he did like a decade of research to try and unpin this. And in the end, it turned out that what was really different between these identical twins was two things: the food they eat, nutrition, as they call it in science, and the microbiome, which is, we now understand, shaped by the food that you eat. And that meant that Tim's own research switched to the microbiome. He became really one of the world's leaders in microbiome science. And so that led him to end up writing this first book, because he felt this was incredibly important for us to start to understand. And it was, I think, the start of his own journey from just writing thousands of scientific papers to saying, actually, I want to help people actually improve their health, and this is too slow through just writing papers.
What was that initial sort of team founding like? And was there a clash of styles between, yourselves who have come from the software background, the cliche of move fast and break things world, and one where, as you say, ad tech's important, but no one gets sick if the ads don't work. And Tim, who comes from, beforehand, a very classic academic and scientific background.
Yeah, there was a big clash, is the answer. So George and I had both been in the internet for a really long time. I had met George back when I joined Yahoo in 2005, so we worked together then. Then we stopped working together, and then after I left Criteo, we come back together and said it would be interesting to try and create something. And I would say for the first year, it was a very difficult interaction between us and the scientists. And it wasn't just Tim, who is actually very flexible and entrepreneurial, which is why it worked at all. But as we then started to get to work with lots of other scientists, some of them like Professor Sarah Berry, who's now our chief scientist, but also many others who joined our scientific advisory board, which was very important as we built this out, we just did not speak the same language, because we didn't understand what scientists care about and what their incentives are. And they were very suspicious of what they call industry, because any suggestion of industry suggests that your results are going to be tainted, they can't be trusted. And so that was a difficult transition. And I think it would never have worked if we hadn't had Tim, who is one of the world's top 100 most cited scientists, so he's incredibly credible, creating credibility for us and helping us to learn how to talk this language and how to create a rather unique company that was designed to be compatible with really top academics who are in fact not going to go and leave academia, because they'd be like, why would I want to do that? I want to be able to figure out the mysteries of the universe, and I want to be able to publish, because that's what I believe is my sign of success. So, if there's lots of entrepreneurs here, they're thinking, well, going public is like the way that proves that I'm successful, or maybe making lots of money is the thing that proves that I'm successful. What's interesting when you speak to scientists is neither of that is very interesting to them. They have this very clear bar, which has not just been published, but there is a whole way to quantify exactly what the value is of an individual paper, which is based upon the exact journal in which it's published, which has a sort of reference rank, like a value associated with it based upon how cited it is. It doesn't matter about the details, but the point is that is their currency. And if you want to end up becoming a professor and you're not, then you need to be published in the right journals. If you want to have great students come and work with you, you need to be on that path. So there's a whole nother world, which is like doesn't intersect at all with the world that most of us who are working for a company know anything about. And it's one also where you have to be really strict about declaring all of your conflicts of interest. So if anyone comes and works with you as a scientist, they'll have to declare it on their papers. And will that question anything they do? So understanding how to work in that world took us a while. The good news is that the lifeblood of science is data. So if you think about what an experiment is, it's like a hypothesis, right? I've got this idea that if you take this drug, it's going to reduce your risk of dementia. But then you have to carry out a study on a bunch of people and then get results and analyze them. And the bit that's hard is carrying out the study and getting the results, because that's expensive, and science is massively underfunded everywhere. And it's, of course, worse now in the US because of recent changes. And so what we did have to offer, which was really exciting, was this idea that we were going to fund basic research to start off with, and then to collect all of this amazing data, and that we had this model which is really brand new for science, which is say we can do something with the community where people who in the future will end up buying products from us can choose to opt into this scientific study, and sort of 90% of people do, and then that data in an anonymized way is made available to researchers who can then do cutting-edge research and publish papers about it.
And have you seen that data flywheel effect of the expansion of ZOE, collecting that data for people who opt in, going into research, and then making ZOE better as a product? Over what timeline does that happen?
So number one, yes, definitely. We've definitely seen that flywheel work. And then number two, it's much slower than if you're doing something just on the internet. Yeah. So if I think back to sort of when I was on Criteo, or anyone who's listening to this who's running something in software, right? You have a bunch of consumers on the internet do things, you get this data, and your algorithms can adjust on it, in seconds potentially. Maybe it's weeks, depending upon what you're doing, and then adjusting. And in the science, all of this is much slower. So if you've got to physically collect data and do tests, you need to get a quantity, possibly, so you might need to collect enough microbiome data to get this insight. So these cycles can be much slower. On the other hand, this might be the first time that anyone has had this data at this scale. So the extent of the breakthroughs that are possible are also really high. And I think that's probably more obvious now in 2025 than it would have been 5 years ago, because I think the analogy with these large language models is really clear, which is the real breakthrough is not really the algorithms, it's the amount of data that was available to train them. And so as that amount of data has gone up over the last few years, we've seen these amazing breakthroughs, right, to ChatGPT and the later iterations. And so I think if you think through into science, if you imagine a place where there was very little data, so when we first started, there were almost no microbiomes sampled with any sort of health and nutrition data, such that when we finished our first big study, which was 1,000 people, basically 1,000 mainly twins in the UK and another 100 in Mass General Hospital in Boston, so it was like 1,100 microbiomes with nutrition data and health data. That was by far the biggest data set in the world. And we ended up having a paper published in Nature Medicine with really the first attempts to understand the linkages between the microbiome, individual bacteria, and health. We're going to publish another paper soon, which at the time that we're recording this right now has not come out, so I can't mention where that journal is, but it's a really amazing journal. It's about 200 times larger than that. So it's on the order of around 200,000 microbiomes. That is still immensely larger than anything else that's being published. And so that seems tiny when you think about the internet, right? People are trained on billions of people. But because this is so new and that scale is so much bigger than anything else, you can do really big breakthroughs.
And as we move, I mean, right now, you're still deeply committed to and doing a lot of work in scientific research, as you've mentioned. But over the last few years, certainly since we've been invested, and it's become more and more evident that the science around the microbiome and broader human health is becoming clearer, thanks to, in part, to the work you're doing. So now is the challenge not so much the scientific understanding of the microbiome, it's more shifting people's behavior. And how does ZOE think about that part of the puzzle?
I think it's exactly the right question. And I think George and I were incredibly naive when we came and set up ZOE. And I've thought about that quite a lot because it's made me notice that many of the most disruptive companies are set up by people who are not already in that sector. And I think it's because if you've been in the sector for a really long time, you're aware of all the reasons why things just have to be the way they are. And so you would never try and do something really crazy. Whereas if you come from the outside, I think you're not aware of all those problems. And you're like, oh, I can definitely solve it. And then by the time you're deep in it, you're like, well, I'm bloody well going to get it to work. And therefore you bring something really novel and you bring some external insight. And I think that is the same situation here, where we went into this thinking, the problem is to try and understand exactly the right diet for you, James, and to get down to this hyper-personalized guidance of exactly what you need. And then basically I would be able to give you a ranking of all the foods and meals you could eat from like, this is 100, it's the best thing you could have, to like 0, it's the worst. Basically hand it over to you. I mean, there would be an app that would tell you the answers, but like basically it would just be there. And then you make those changes and everything would be brilliant. As I say those words, and I'm sure any listener is saying like, you're an idiot, Jonathon. Like, that's obviously makes no sense. And the answer is right, you're right. I'm an idiot. We were idiots. And that's not because that part doesn't make sense. Like being able to get better guidance is really important. And it's important because most of the things that we've been told about nutrition in the past have turned out to be wrong. And so we're all walking around with assumptions about what to eat that is wrong. And the other reason that's really important is that the big food companies who produce most of the food that we eat, if you're sitting here in Western Europe or the US, are not our friends. They are motivated to make as much money as possible. They are incentivized to promote processed food, optimized for us to spend as much money as possible on something that is as cheap as possible for them to make, and where we now know that there are deeply harmful health effects from a lot of this high-risk processed food. And so again, there's all of these things with like stickers on your food telling it's high protein or low fat, and almost all of these things are not going to be good for you. And so you're in that environment where you don't know what's good for you. So it is really important to discover what's right. The problem is just knowing this isn't good enough. And I think that's obviously really obvious because we can all think, well, I know that I shouldn't eat like loads of hamburgers and French fries, and yet lots of us do because it tastes good and it's appealing. And so I think it took us a long time, too long, to recognize that behavior change is even more important than the advice, because unless you can deliver that support for someone to understand where they are right now, the realities of their life and their current habits, where they need to go to, and help them step by step, it's not going to work. It just sounds like, yeah. Obviously I should just eat rabbit food and quinoa, but like, I don't like that. I don't want to do that. Why should I? I'm busy. It's expensive, etc.
Yeah, I think as investors, the naivety sometimes of coming into a space which you haven't been studying for 20 years as investors is quite helpful as well. We certainly see that in some of our more frontier technology companies. But often we say to ourselves, actually, when we're making an investment, it's not the scientific risk you're taking, it's the go-to-market risk, or it's the behavior change risk, because it's the breakthrough is great, but it's the distribution of the science that really matters, and it often undervalued. Has that changed? Has that sort of thought process, as you came to realize that was such a big part of the puzzle, has it changed the kind of people you hire or the people you surround yourselves with at the company? Are the skill sets different within ZOE now?
ZOE is a very unusual company, and that's because very few companies are trying to combine real science also with a real consumer digital product. That's very unusual, and I think we've always been sort of in this strange place, because there are lots of companies which are really science companies, and generally they are building a drug that ultimately a pharmaceutical company is going to sell across the world. And that's a very well-known model. And those companies are stuffed full of scientists, and they do this amazing science and research. And they never have to think about anything commercial, because they will end up proving through a series of trials that this works. And if you get to the final stage of trials and you prove that this drug reduces the risk of Alzheimer's or whatever, you don't need to do anything commercial, because you have all these pharmaceutical companies that will line up to either buy you or cut a deal. So they are like really, really clean. They're almost like, if you think about the world I know more in tech, it's almost like you just have to do the deep AI, and then effectively you're going to be sort of, the company's going to be sort of acquired at the point that you want to roll it out. And the people who invest in those companies understand that incredibly well. And there's a whole set of venture capital funds that understand all of that have basically no intersection with the rest of the venture capital ecosystem, right, James?
Yeah.
And then on the other side, you have everything which is basically going to say, I'm going to end up building a product that is either going to be sold to consumers or to be sold to businesses. They have their own models. And the reality is that they have technology in them, but it's very rarely really like cutting edge technology, in the sense that it's something that only a few people in the world understand how to do and how to do the science. Maybe the closest to that would be people building historically chips or something like that, or telecoms equipment. It's closer to that. But even then, they're basically all engineers. They're not actually scientists. And so in our case, what's strange is a very important part of the company from the very beginning has been people doing real science, who understand how to do randomized controlled trials, get published in top medical journals. But then we also have all these people who are used to doing front-end mobile development. And one of the big shifts that we've made is to focus more and more on behavioral change science on the one hand, and then how do you build really great sort of front-end mobile experiences. So we have to pull that together from one end to the other, with a whole bunch of AI in the middle as the thing that's sort of the glue between the data on one side and what comes out. I think that's been challenging, because they don't naturally talk to each other. So you sort of end up putting a set of, the product managers who have to manage the science side are doing something incredibly different from the product managers who are thinking about like the onboarding experience for day zero on the app. That has been hard, and we have taken a lot of different attempts, I think, before we've figured it out. On the plus side, we don't spend a lot of time worrying about people doing the same thing as us, because honestly, it was so hard. And there's such a big moat now around the data and the science. So we don't worry about that a lot. We worry about, we're on this mission to try and improve the health of millions. We do feel like it's a bit of a battle against big food companies. we worry about whether or not we can win that, because I think I've got more and more passionate about how important this is, the fact that people can transform how they feel, but also we are surrounded by a sea of misinformation, much of it, I think, cynical. So it feels really important. It's a hard thing to do, and you've got to get all of these pieces together.
And I presume you felt that on the investor side, as you said previously, that there are a group of investors who really understand life sciences really well, and potentially have looked at parts of what you're doing on the life science side, and understood that, but have a different worldview as how you build companies or exit them. And then you have a consumer software side, which is once again a different worldview and how you might think of exiting it. And rarely do those investors cross in the world today. So how did you navigate that fundraising path? Did you end up just with one type of investor rather than the other, or did you feel you had to change the narrative to fit the type of venture fund you were pitching?
So first I'd say I think that is challenging. If anybody is listening to this who is trying to develop their own sort of deep tech in whatever it is, right? Whether it's nuclear fusion or some sort of cool mRNA thing, whatever it is, that doesn't just fit into a classic model, I would just offer a lot of sympathy, because it's hard to find investors to do that. And it's also hard to find the right senior team that has experience to navigate that world. In our case, the answer is a bit of both of what you said. I would say the majority of the investment has come from investors who are used to traditional consumer-facing software. So they've done lots of deals in the internet, they've seen lots of consumer businesses work, and so they think about this ultimately as, okay, how can you build this great business that's going to transform the health of millions of people, that you can scale through classic approaches that are proven about acquiring customers, looking at lifetime value, thinking about retention, thinking about all the classic consumer marketing models there. We do have some investors, however, who come at this completely the opposite end and are saying, this is amazing, you're actually transforming health outcomes. I know that payers in health insurance systems in the US or elsewhere will end up paying money for this, because this is actually going to save them large amounts of money and improve health outcomes for people. I mean, the thing that I am most excited about with ZOE is we did a randomized control trial that was published in Nature Medicine last year that proves we work. And so we did a direct control against the best, what they call standard of care in the US, and we had much better outcomes on everything, really. So short term, like sleep and energy and mood, but also changes in weight, reduction in weight, reduction in waist circumference, reduction in biomarkers. This is like blood markers that are things like triglycerides that tell you about your long-term risk. And they're incredibly excited by that, because they can see you're on a path to saying food really is medicine, and lifestyle interventions can have this profound impact on giving you many more healthy years of life. So they see it through that lens. They get really excited by the publications, the science, and basically these two investors look at the business through completely different lenses and almost don't see the other side of the business. So I would say most of the traditional sort of internet software investors perceive the science as having no value whatsoever. Like, it's only useful if it helps to make the product better so that consumers care about it. I don't think that's right. I actually think the most exciting thing we're doing is scaling up this data set about the microbiome. So this is completely unknown to science 20 years ago. It's only through this new shotgun sequencing technology, which is, I think we all got used to through COVID, this idea that you could actually analyze the DNA of a virus and discover exactly what's inside it. Basically, it's the same approach where you can give me a little sample of your poo, or your poop, as they say in America, just a very little bit of it. We smash it up, break out all the DNA from all of these different species of bacteria inside you. We sequence it, and we create this immense data set of tiny little fragments of DNA. You then apply some very clever machine learning to put it's like a jigsaw puzzle. The way I like to talk about it is like, imagine you took a photo of the Mona Lisa. Imagine you made 1 million copies of that photo, and then you put it through a shredder. So every bit just got like a millimeter by millimeter size bit of Mona Lisa. Then you got your kids to come in and like take almost all of it and throw it away and just got left with a tiny bit that's left behind. Then you took that to like the AI and said, could you figure out what the picture is? And that's basically what it does. And what's amazing is it comes back and it tells you, James, I know that you have got 23 of the 50 good bugs and you've got 17 of the bad bugs. This is what they are. This is their relative proportions. And from that, we can understand your health and we can link that. And it's increasingly linked to many different health conditions. So I think that ability to scale that up is going to prove to be incredibly valuable for influencing long-term health beyond the advice that we can give today. But I would say most investors are like, whatever, like maybe, but I'm not going to even consider that as I think about the business. What I'm interested in is, okay, can you ultimately make a business where consumers will pay you directly for this advice in the same way that they might think about buying, an Aura or a Whoop or these sorts of things. So it has been strange to navigate. And if anyone was looking for advice, I just say, understand who your investor is and tell them the story in the language that they will understand. And it's going to be harder to raise money for a business like that than one which is sort of classic. It's also going to be much harder if you need to do a lot of investment before you see consumer proof. And so that's another challenge with any business like this. I think we've got used to this idea that you come up with an idea, you like build an app or a website or something, and you can sort of prove, or even if it's a SaaS business to B2B, like these tools are now to do this are really quite cheap, and you've got the cloud and you can like prove the whole thing in like 18 months. Oh yeah, this definitely works. The question then is like, how big is it and how can it scale? But if you're building a fusion reactor, that's not how it works. And that is much harder because the level of risk is really high for investors and it's very hard for them to be comfortable. So my other advice is find investors who are old. Why do I say that? It's not because they're old, but the point being, find investors who've been doing this for a long time, because you need investors who have confidence in themselves and are feeling comfortable that they can take risk. And generally, it's very unusual if you've just been doing this for a few years to feel that confident in your own decision making and that willing to take risk. And so the challenge is, how do you get to those people? Because they may be harder to get to than someone who's just starting this. But I think that would be sounds silly, but honestly, when I look across our investor base, I have one very unfair advantage, which is it's my second time around and it is much easier to raise money. So another advice would be, can you find someone to come and join your business who has done this before as an entrepreneur, who therefore probably the investors will think will de-risk the business, and they probably will, truthfully, because of that experience. But the other thing is to find investors who are really willing to take those risks.
I'm sure Daniel, our board member at ZOE, will be happy to hear that you went for him because of his age.
Well, I've known Daniel for a long time, and I like to think that he follows a lot of the advice that ZOE gives him about his diet, and he's looking incredibly young. But there are a few. His chronological age is definitely no longer in the 30s, even if his biological age might be.
I think he's a great advocate incredible advocate of ZOE's, but also he really cares about what you're building as well. And I think one of the joys as a venture partner, the six of us here at Balderton, is seeing your partners get incredibly passionate about the mission of a company, not just the financial returns, although obviously we have to consider those, and that's our primary motivation. And it's certainly an area where he's mission aligned, right? And comes into the office covered in 4 or 5 different trackers and with marks in his arm where he's had his CGM in, and he's just in his ZOE tests, scanning every meal, which is great to see. And I think the great thing you've built at ZOE is a brand which is not just Daniel, right? You have millions of people now who are aware of it and passionate about the mission as well.
Firstly, thank you. And thank you, Daniel, if you're listening.
Yes.
I love that you are passionate about it here at Balderton as well as elsewhere.
It's when he's scanning his own food, it's okay. It's when he leans over and scans your meal.
It tells you that it could be better.
Yes, exactly. That's the annoying bit.
We don't really approve of being that judgmental. Like, nothing is off limits at ZOE. That's important. So I think it's the question a bit about, like, is the mission side being important?
Yeah.
I mean, I would say at a personal level, it's incredibly important, first of all. Like, to me, the thing that motivates me, even when we have a really tough week or a tough month, is the mission. And that's very different from, anything I've done previously since I started work. And if anyone listening is thinking about doing something where it's a mission driven, I would say do it. It's amazing how it carries you through, both in difficult times, but also it's amazing. Like, people come up to me and say, ZOE changed my life. And that isn't it. I've never been a doctor or done anything like that where you would feel or a teacher or something where you'd feel you do something that valuable. That's amazing. And I think when times are tough, and we've been public that we had to reduce the size of the organization a year ago, that's really difficult. The fact that you're driven by this mission is really powerful for yourself. The other thing I would say is it's incredibly powerful for the team. And I think that the culture at ZOE is really remarkable. And that's not because of some magic that I did or like Tim did or George did when he was in the business. I think it's because when you're doing something which is mission driven, that becomes this central thing that really determines whether people want to join, why they want to stay. Like, it helps with alignment. And I think one of the things that's really nice is that people care more about this than 20 or 30 years ago, as they were thinking about building businesses. And it was very much about, like, build this thing in order to make lots of money, and maybe it's cool, but I don't think there was a lot of focus on, are you doing something really good? And I think there has definitely been an increase in that. And I think that has really helped us to build a great company, but also it creates alignment, because it creates clarity about what you will and won't do. And I think you can have a mission and clarity even if it isn't as directly health focused in your business, or as directly focused on, taking carbon out of the economy, or free power, whatever these things might be. I think having that mission, that it's a sort of mission you could actually be proud of and explain to your mum, like, why. In the same way, we were all basically, I think almost everybody in this call was probably brought up with a really clear set of ethics in the first 10 years of their life, because we tend to be socialized by our parents and our schools about what matters. And then I think sometimes we get like reprogrammed as we're older. Like, you go and do these terrible economics classes that tell you like the only thing that matters is money, and you're surrounded by other people with these things, these hoops you're supposed to jump through. And I think you end up with this horrible tension inside you between what you sort of know is important and the sort of things, when you have children, that you actually tell your children matter. And I think the test is like, the way I think about it is like, when you tell your children what's really important, are you living your life aligned with that? And if you are, brilliant. If you're not, like, how might you adjust what you're doing? Because you will feel much better if there's less internal tension in your life. And I think a huge number of us have sort of been brought up to feel that there's almost these two different worlds. There's like your private world where you have these, where you do the things right, and in the public world somehow none of that matters. I don't think that's true, and I actually believe that you can generate great returns for your investors while still saying, the primary objective here is to deliver on this mission. But if we're going to do it, we're going to transform the health of millions. We're going to have to get tens and eventually hundreds of millions of people to engage with ZOE, understand what they're eating, start mindful eating, start to discover what's in their food, start to make changes. And of course, that has to end up being a big business. It's not possible otherwise. But rather than driving just head on for like making as much money as possible, I think by being focused on the mission, you can build something more sustainable and something that is more transformative. Now, I would say that because that's what I'm doing, but genuinely, I think that's possible.
Yeah. And look, when we do investments, we have this section called, what you have to believe. And these are the things you have to get your head around and believe in order for this to be a great investment, right? For this to be a significant impact on the fund, 10, 100 times returner. And in ZOE's case, we fundamentally have to believe that ZOE is going to change the habits, nutritional habits of tens of millions of people. You have to believe that going into the investment. And at the time when we made the investment, there wasn't that much data yet to show that to be the case. But we're, very much aligned that the journey is incredibly exciting. And if you achieve that and you change the lives of tens of millions of people, the outcomes, obviously, as a whole, will be far greater than just the returns for your investors, right? It's impact on those millions of people that really matter.
I think it won't surprise you to hear that our biggest focus has been, how do we make getting into ZOE easier? How do we make it easier to really start to make the changes? Because we know that once you've really made these changes, it becomes very self-supporting because you just feel so good and you've rethought the way you're eating, from thinking about calories and low fat to like, how am I feeling these bugs in my gut? But getting there is hard. So firstly, if you're in the US, we already have a free app that you can download, and that's never existed before. And this is available also in the UK through the paid app. And the whole central idea behind that app is actually we can help you to understand exactly what's in your food. So you can snap a picture of anything or barcode scan it and discover exactly what's inside it, how healthy it is for you, and get this processed food risk scale. So understand whether or not it's a high-risk food, right? James, I was showing it to you over lunch. It instantly understands all the ingredients. It understands the score of those ingredients for you, gives you a score for this meal, and helps you to understand, as you do that through the day and start to create this habit of mindful eating, understand tomorrow how this food has affected you today.
And your score at lunch was 100, which is very impressive.
Thank you.
And it looks very delicious as well.
And it looked delicious, which I think is really important. That's right. So that is all there on the app. The other part is the test kit. I think this is interesting for anybody who's coming out of this sort of deep tech background. We sort of came from this full scientific kit and then simplified it to try and get to a consumer level, which also means that it's going to be cheaper. And so I think that's, in a way, like, what would I have done differently before? I think I probably would have said sooner, okay, you've got the science on one side. If you came from it from the consumer angle, how would you try and do this? And how would you try and get there sooner? And it's hard. And I guess I would just leave with anyone who's struggling along the entrepreneurial journey, which is try not to beat yourself up for all the bad decisions you made in the past. It's inevitable that you're in this sea of uncertainty. You're going to make mistakes. I make mistakes all the time. I tell the team all the time, it's fine to make mistakes. The question is, did you have a hypothesis? Did you know why you were doing something? Were you able to sort of measure the results? And then you adjust. And I think most of the entrepreneurs that I really respect, it's not like they got it all right at the beginning. It's like they had that mindset where they're constantly adjusting and realizing, oh, I've learned this new thing, I'll go that way. And so weirdly, you've got to be both totally inflexible and really flexible at the same time, which makes no sense, I realize, as I say this.
Look, I think a meandering path is a very good sort of anecdote or analogy for the entrepreneurial journey. And going back to the future of the test, we're really excited about what's coming next with ZOE. Daniel and I were both very early beta testers at ZOE, and I remember us going through the whole process and sharing it with the team, and everyone said, "Look, this is quite a lot to go through," and we really stressed the point that given the price point being relatively high and sort of the procedure to get data being relatively complicated at first, despite that, people were doing it and loving it and getting health results from it. So, we were just like, well, can you imagine how much more impactful this is going to be when it's a lot cheaper and a lot simpler, right? So the fact that you were still helping people, even with the price point and the process, I think was, huge credit to the team, but the future of it is even more exciting.
Thank you.
Thanks for listening to What's Next. We hope you enjoyed the episode, and if you want to learn more about the frontier of deep technology in Europe today, please like and subscribe. And if you're interested in learning more about working in deep tech, look at the Balderton website to learn more about us and our portfolio companies.